Hello, my name is Jason Butler, and I will be presenting Mental Health of Children with Incarcerated Parents. This was a project that we put together in the Capstone 2 course for the Family and Human Development Master of Science program at Arizona State University. The project was put together by myself, Jason Butler, along with a group of my classmates who included James Artis, Celine Hardy, Jenna Marshall, and Taylor Wilson. We'll start by discussing incarcerated parents in the United States. This is becoming more and more of a problem as in recent years the number of individuals who are incarcerated in prison systems as well as state and county jails has been on the rise. This problem not only affects the adults who are incarcerated, but something that we often don't think of is it also affects the children of these individuals. And so we'll look at a few stats that go along with that. 1 in 28 children have an incarcerated parent. 1 in 10 children live with someone on probation, and approximately 10 million children are being affected by parents who are incarcerated. So these numbers are pretty large if we really sit back and think about it. That is a lot of children who are being affected by parents who are in jail, and the effects of the incarceration on the children can have a really huge negative impact, something that we will discuss in the following slides. The negative impact of parental incarceration includes attachment issues, financial difficulties, unstable environment, decreased supervision, and stigma and labeling. Attachment issues can arise from the fact that the parents may be absent. This can affect the children depending on what age group they're in. Younger children may have a problem with wondering where their parents are. They may not understand what is happening, so they may not understand why their parent is absent. This misunderstanding can create attachment issues. It can create issues of abandonment. And this is true also of adolescent age children who are a little bit older. They can also feel abandoned and also have those feelings of wondering what happened or why they're going through this or how long it's going to last. Another issue that comes with parental incarceration is financial difficulties. As we all know, it's really difficult in today's world with finances and trying to create a family and maintain a good environment for your children. Oftentimes in today's world, it takes two parents who work full time in order just to make ends meet depending on where you live. So if we're talking about a family who has one parent or both parents who are incarcerated, it is going to put a serious financial strain on the household. And this can have lasting impacts on the children growing up in poverty. Another thing that can be created is an unstable environment. This can happen from a number of different ways. If parents are incarcerated, depending on whether the parents are together or not, this may force the child to live with the other parent if they're not married. And if they are married, it still creates an unstable environment because then they're having to live with one parent when they're used to having two. It can also lead to parents being placed in foster care, which is can have a huge negative impact on children. And again, go back to the attachment issues and maybe create some abandonment issues. Children may also be moved around from house to house. They may be forced to stay with relatives, which could include grandparents, aunts, uncles, even older siblings if they're old enough to take care of the child. So it can create a thing where children are being bounced around from home to home, whether that's with people that are familiar with them or unfamiliar in the case of being placed in foster care. Either way, it's an unstable environment and it is not good for the children. The next factor is decreased supervision. So depending on who has custody of the children, and even if it's the parent. So if there's one parent, there is going to be a certain level of decreased supervision that comes with only one parent being able to watch them and kind of create an environment where there is structure and discipline. If they are staying with relatives, they may not be as supervised as they may be with their parents. And again, all of these factors kind of play off each other. So depending on the level of financial difficulty, the parent or the caregiver may be working so much that they don't have time to watch the child. So either way you look at it, with incarceration of a parent, there is going to be some level of decreased supervision, which is not a good thing. Lastly, there is stigma and labeling. This can come from several different areas, even within the family. Relatives may look down on the parent who is incarcerated and kind of create a thing where they're labeling and stigmatizing either the parent or the child. Either way, the child is going to feel the impact. This can also happen in their social world within their peers. So a good example would be at school. If the peers at school find out that the parent has been incarcerated, that can create a lot of problems for the child and being bullied, maybe made fun of. So that creates a big problem with stigma and labeling. So those are some of the overall general problems that can be created with the incarceration of a parent. There also is a difference between paternal and maternal incarceration. So depending on which parent is incarcerated, it will have a different impact on the child. And that's also dependent on the sex of the child as well. So we'll go ahead and look at that now. The impact of maternal incarceration. So if the mother is incarcerated, maternal incarceration has a bigger impact compared to paternal incarceration. Boys and girls react differently based on the timing and longevity of the incarceration. It impacts sexual behavior in adolescence and increased social problems and school performance. So when mothers are incarcerated, it has a bigger impact opposed to when fathers are incarcerated. It also depends on the timing and longevity. So when mothers are incarcerated, boys have a harder time dealing with that depending on when that happens within their development. So depending on their age and where they're at in child development, it can have a greater impact on them opposed to how it would impact a girl the same age. On the flip side of that, girls are more impacted by the longevity of the incarceration. So depending on how long the parent is incarcerated, the girl would be more affected than the boy. It also impacts sexual behavior in adolescents. So studies have found that adolescents have increased volume of sexual encounters when the mother is incarcerated, as well as more risky sexual behavior. And then there's increased social problems and school performance, which can raise concerns not only in the present moment, but also in the future. So there are problems within the school as far as school performance, academic performance, as well as behavioral problems. And they've also shown that children with mothers who have been incarcerated have higher dropout rates. So that is something that can have a lasting impact on a child going into adolescence and into adulthood. If they are not able to finish high school, the likelihood of them succeeding later in life drastically decreases. The impact of paternal incarceration. So children who have fathers that are incarcerated tend to show aggressive behavior, juvenile delinquency, increased use of illegal drugs. So an absent father in a child's life is never a good thing. When it is due to incarceration, it tends to have even more severe effects that can be lasting and again have an impact on the child's later development when we get into talking about juvenile delinquency and trouble with the law. That's something that can follow the child well into adulthood, especially if they're developing these patterns of behavior and not being able to correct them. And all of these things lead to juvenile delinquency, aggressive behavior, and drug use, as well as alcohol use. Another factor that plays a role in that is the fact that if only one parent is there, the level of supervision is not going to be adequate, as well as if a mother is trying to establish an environment that has structure and discipline, she's not going to have the support of a male figure in the child's life to kind of back up what she's trying to do. So that can create a lot of problems for the child. The next thing we will discuss is the impact on mental health. So some of the ways that parents being incarcerated can impact mental health include increased risk of ADHD and conduct disorders. So some of those things we kind of discussed. You can see the ADHD and then the conduct disorders kind of show up in some of the risk factors that we showed as far as performance in school and juvenile delinquency and some of the behavioral problems as far as aggression and things like that. Another thing, and we did discuss this previously, is attachment disorder and then PTSD. So PTSD is a big one. When we have adults who are involved in criminal activity and the criminal activity is severe enough that they are institutionalized or put in the correctional system, the child has probably seen some of that behavior, and that can include a host of different things that include domestic violence, drug and alcohol use, maybe sexual abuse, other criminal activity that could include stealing or theft. So having to witness those things as a child can create some trauma, and that can lead to PTSD. One thing that is important to note with all of these, the impact on mental health, is that all of these studies have shown the likelihood increases for children who have parents that are incarcerated to have some of these disorders and symptoms. However, they can't find causation. So there are a lot of other factors that go into determining how a child may develop some of these things. So there's no way to really tell if having an incarcerated parent is the cause of these things. However, the research does show that when the parent is incarcerated, the likelihood of the child having some of these things increases drastically. So now I'll discuss some of the treatment for children of incarcerated parents. Those include trauma-focused cognitive behavioral therapy, school-based therapy and counseling, medication, and alternative treatment. So the trauma-focused cognitive behavioral therapy, as we discussed earlier, there is a lot of trauma that can be created for children when they grow up in an environment where parents are incarcerated. Having to grow up with some of those things that lead to the incarceration can create a lot of trauma. So one of the things that they use to treat that is trauma-focused cognitive behavioral therapy. The next one is school-based therapy and counseling. This is a big one because a lot of times, as we discussed previously again, is that a lot of these children may not have the most stable living environment. They may be bouncing from place to place, but one place that is structured and is kind of a constant in their life is school. So that's a place where they can kind of go to find that stability and kind of find some of that structure that they may be lacking. And it also may be an environment that is safe and comfortable for them. So if we can get the school involved and kind of some of the school-based therapies and counseling can kind of help the child in some of the areas where they're lacking, and that's also one of the places where they probably spend the majority of their days at school. So the school-based therapy and counseling is a really good aspect of treatment for children of incarcerated parents. Lastly, we have medication. So depending on the severity of the mental disorder or the mental problems that the child is facing, medication may be an option. One of the things that we discussed in our group is that we would like to see more of the school-based therapy and counseling as well as the trauma-focused cognitive behavioral therapy before any medication is discussed. Also, something that I added in was alternative treatment for minority groups related to their own specific culture. So I'm a Native American. I work in the behavioral health field on the reservation here in Idaho where I live. And one of the things that we've been trying to do, especially with some of the trauma-informed care, is trying to get things that are tailored to the specific population that we're working with. So the Shoshone-Bannock tribes that I work for, we take some of the cultural aspects that are related to that specific tribe and try to integrate that into some of the things that we're doing. Some of the other things that I've read about for some of the inner city places, I've seen some hip hop therapy where they're taking kids and kind of using music to kind of help them to deal with some of the things that they're going through. Another good thing that I've read about is art therapy, and I've seen some of that done with some of the Native American communities where they do basket weaving and rug making and beadwork and stuff like that. So alternative treatment, when we talk about different minority groups, a lot of the Western theories that are being used in Western methods of treatment sometimes don't fit so well with some minorities. So it's always good to look for alternative treatments that are tailored specifically to the group that we're dealing with. Some of the recommendations that we came up with were Girl Scouts behind bars, Boy Scouts behind bars, Boys Council, Girls Circle, increased family help within the correctional facilities, increased school involvement, family counseling, and alternative methods. So the Girl Scouts and Boy Scouts behind bars is a program that is similar to the Girl Scouts and Boy Scouts of America. However, it's designed specifically for children who have parents that are incarcerated. So they get these groups of children together and they actually go into the system where the mothers or fathers or grandparents are incarcerated, and then they actually work with them. So it kind of creates an environment where they are able to see their parents and grandparents and work together with them to form better relationships. Boys Council and Girls Circles are groups where individuals can get together and discuss problems and talk and express their feelings. We also had increased family help within the correctional facilities. So we'd like to see more correctional facilities kind of implement programs that are specifically developed to help inmates with their parenting skills and abilities, as well as try and reconnect them with their children. Another thing, and that's what we discussed in the previous slide, is increased school involvement. So although school is a place where a lot of that takes place and is happening now, we would like to see kind of an increased volume of school involvement as far as this subject is concerned. The next thing is family counseling. So if you remember in the opening slide, I discussed that oftentimes we focus on the individual. So that goes with the individual who's incarcerated as well as with the child. So we often try to treat the individual for their individual problem, and we fail to look at it as an overall family issue. So we'd like to see more family counseling and then alternative methods. So this can include some of the things that I discussed in the previous slide as far as cultural specific methods, but also we'd like to see just an overall development of people thinking outside of the box and trying to find solutions to a problem that really affects us all in today's society, and trying to figure out innovative ways to go about dealing with this problem and trying to solve the problem. So oftentimes in the social sciences, we get stuck kind of doing the same thing over and over again, and we fail to see that some of the things that we're doing aren't working so well. And if we can kind of take those ideas and expand on them, and by thinking outside of the box, we can develop new and innovative ways to kind of combat the problem that we're dealing with as far as children that are dealing with incarcerated parents. So that is my presentation. I hope you guys enjoyed it, and have a good afternoon, good night, or good morning. Thank you.